Governor has, and the state has published a very, not a detailed, but, an outline of the various priority groups. And right now it's a three-phased approach. And we're in the first phase, obviously. And the first phase is broken down into, tier A, B, and C. And we're currently in tier A. And right now in tier A, we are focused on people, really the highest risk individuals. We're trying to get the vaccine out to those individuals who are at greatest risk of developing severe COVID disease, and those occupations that are treating people with severe COVID disease. And right now it is, 1A is healthcare workers, it's hospital workers, it is those who live in a nursing home or work in a nursing home, uh, those who are licensed healthcare providers or certified healthcare providers. And we're also doing first responders. So our EMS and our firefighters and our EMTs and our police officers are involved. And lastly, the last group in 1A, which is also our public facing judicial employees. So these are our court commissioners who hear the cases of, I think, individuals who are arrested, and they need to process charges in front of the individual. So they're an important group of folks. And so that's tier 1A. So now if we talk in tier 1A, we're in the middle of doing that right now, getting everybody in Kent County, reaching out to them, extending an invitation to get them to come in and get vaccinated. And then once we get through 1A, the next phase is obviously 1B. 1B, we're going to focus on those who are over the age of 75. So that's the individual age, determination, because we know that people who are over the age of 75 are at greatest risk of developing severe COVID disease, and we want to get them vaccinated. Also in 1B are continuity of, I'm sorry, our continuity of government. So this is going to be, our essential government employees. That also in 1B, we have our, all of our education workers. So that's going to be anybody involved with, schools or the school system. That would be public school, private schools, child care services. It's going to be teachers, it's going to be administrators, it's going to be bus drivers, it's going to be cafeteria workers, custodians. If you are working in and around a school, we want to make sure that we get you vaccinated, because right now in 1A, it's by invitation only, because the vaccine supply is limited. When we get into the later phases, the way this is going to work is we will have a link on the main Kent County Health Department webpage. That is kenthd.org. That's the address that you go to. You go to the main Kent County Health Department webpage, and you will see a link for COVID vaccination registration. And once you click on that link, you will be given a number of options about, times and days. And, as we get you to register, we ask some demographic information, some health insurance information, and we also ask personal medical questions that might screen you out if at this point there is the vaccine is provided free courtesy of the federal government. So your federal tax dollars are paying for it, and we have been advised that the health department and other providers can request from your insurance company an administration fee, but there will be no copay. There will be nothing out of pocket from from anybody looking to get vaccinated. We're working on building a core of volunteers that can help. Anybody who has difficulty with, computer issues, if they don't have, if they don't have a computer, don't have internet access, or don't understand how to make a computer work, we will have resources available. I would ask, everybody to, please be patient. We are going to have, we want to get everybody vaccinated. It's going to take some time to do it. What we're really focused on at this point is identifying those individuals who are at greatest risk of, developing severe disease from this and potentially dying. So this isn't, it's not an arbitrary process. This is, it's sort of, a very detailed plan to help mitigate the risk that this has created. And I guess the big takeaway is, ask the community, please be patient. We do want to, inoculate you.